So good afternoon, everybody. It is March 11th, just a little afternoon, and our weekly vaccine in Nevada County, Vaccinate Nevada County update. We're joined by Ryan Gruver, our Health and Human Services Director for Nevada County, and Jill Blake, the hardest working woman in Nevada County because she's the Director of Public Health. And yes, Jill, it's yes, believe me, I know. I can actually say that. So we got a couple questions that we received ahead of time, but Ryan, maybe could you kick us off with where we're at and how many shots in the arm have been done? How many doses?
Yeah, thank you, Pascal, for having us again. I'm Ryan Gruver, as Pascal said, the Health and Human Services Director for the county. So we continue to make good progress. We are approaching 30,000 shots in arms for Nevada County residents at this point. We're 29,000 something, so just on the cusp of 30,000. Our allocations have increased markedly compared to a few months ago. That were at the very beginning, we were getting sometimes 1,000, sometimes 0, sometimes 100, and this week I think we're receiving somewhere in the neighborhood of 5,000 doses. So, and Jill, you can jump in with actual numbers as opposed to
5,040.
5,040. So yet still, for just for a dose of perspective, with approximately 40,000 Nevada County residents currently eligible, and with almost all of our 30,000 shots in arms being out of 2-dose vaccines, it would take around 80,000 doses to fully vaccinate everyone who's currently eligible. So we've still got a ways to go, even with the current supply, just to get through the people who are currently eligible. We've been allocated some initial allocations of Johnson & Johnson, which will be a game changer because it's a 1-dose vaccine. But we received an initial allocation and won't receive any more till March 23rd. But that is definitely on the horizon, and that will continue to provide benefit to the community. So, Jill, I don't know if you want to fill in any gaps or details there.
I would just do one clarification, Ryan, and that is that the state doesn't anticipate getting another allocation of Johnson & Johnson before March 23rd. If they get it then, we'll get an allocation. We would see it the following week. So I just want to just point out, because there is actually quite a demand for the Johnson & Johnson, that it will probably be a week or two later that we'll actually have it.
Okay.
Great. And I have to say that we have we have a couple questions that came in, and maybe let's get to those first. Some of the overwhelming question is, hey, when I've signed up to my turn, I'm not getting any notification. Do I have to sign up again? Is the system working? Where are we at with that?
I can jump in on that if you guys want. So I understand that frustration. We have it too. So the system is pitched as one where you can receive those notifications. The front-facing web page states that, and it is active in some counties. It's not active yet in Nevada County. We thought it would go live last Friday. There was a testing of that system this week, and it seemed to work. And so we're expecting that notification component should go live within a week. And I know we've said that before, and every time we've meant it. It's not really just trying to put people at ease. We wouldn't want to put that out there unless we thought it was going to happen. But that is a really important function of the system. So not everybody has either the capacity or the time to continually check that system, to check for appointments. We know that people are relying on that notification to both find out when they're eligible and when appointments open up. Because it hasn't been working, we've been trying to get the word out that we typically post those new appointments on Fridays around noon, so that everybody has that information. And if you don't get that notification, please do check My Turn on Friday around noon, because that's when the appointment should show up for the following week. So again, hopefully within a week, that notification component will be functioning correctly.
That would be really good. And then we got some questions about people who live in Nevada County and they got their vaccinations either at Walgreens or other, and some people are actually trying to help their friends and keeping track of the pharmacies that are giving vaccinations. And why is there no information available about the pharmacies that are providing immunizations from the county or from us media types?
I know that we've put out information before. Ryan, if you can check our vaccine webpage and see if it's on there, but I know that we've listed the pharmacies that are vaccinating. I will say that they're not receiving vaccine and they're not part of a state program, they're part of a federal program. So I don't know if the pharmacies are doing their own outreach as well, but there are at least 3 in Nevada County now that are vaccinating folks. CVS down on Combi Road, Rite Aid in the Brunswick area, and Walgreens in the Brunswick area as well. And I know that I believe we've put up the web link for those, for the scheduling of appointments at those 3 on our webpage, and Ryan is nodding, so that's good.
Yeah, I just checked as well. It is on the resource page.
Great.
And as far as media goes, I can tell anybody who's listening that we went ahead and we reached out, and corporate communication said that it would be very hard for them to provide us with up-to-date information, even weekly or monthly, because this is such a small market. So that was, I'm paraphrasing, but that was the answer for all three corporations. And another question we have, we still haven't been able to get appointments. What are we doing wrong? We signed up with pharmacies in early February, and they only let you sign up once, presumably with the email address. My Turn is not user-friendly, and it has not worked for us, and no notifications. And then there's also people who say that they actually managed to they get the number, the code number, and when they make a mistake, by the time they get another code, the session is timed out and all the appointments are gone. So do you know how long the sessions are, and is that something that there needs more work needs to be done, especially with our relatively slow connectivity here?
Yeah, that's the first time that I've heard that people are timing out before they can get an appointment scheduled when they're, they go in and they see that they're available. So that's good information for us to give back to My Turn. Again, that's the first time I've heard of that. And Dr. Kellermann, were you going to say something about that as well?
Well, I do know that internet could be a whole lot better here. I mean, I'm hoping, Pascal, you do a show on fiber optics. I mean, why in the world do we got so many IT folks up here that if their kids are downloading a video game that, they can't carry on a conversation or can't continue their communication? I think it's a real problem here. That's a whole nother issue. And the other issue, obviously, is the people that have the easiest access to the ones that are more computer literate. And we're trying.
And a typo apparently can then, by the time the system generates another code and texts it back, then the session is timed out. And obviously, since people are really looking to get these appointments, then the appointments are gone. So maybe a longer timeout for a session timeout for rural counties would be something really helpful.
I made a note of that, Pascal. I'll give that feedback to the state today.
Great, thank you.
Thank you.
And let's go to our audience questions here. When might those between 60 and 65 be able to get a shot?
Well, it depends on which county you live in.
Nevada County.
Well, yeah, because there are certain counties that are scooted right through. One is an example of Sierra County. We're following the state guidelines. It's going to be on the 15th, 4 days from now, it's going to be people with chronic conditions. So if they have a chronic condition, they certainly can move right in. It won't take long for us to move through those groups. We're getting more immunizations, and we got more partners with respect to offering immunizations, including pharmacies and Sierra Nevada Hospital and Chapaday. And so I think it won't be long before we start moving down the ladder of people that will have availability for immunizations. To give you a date, it's hard. I mean, we're all mandated by the state, but we're following the state recommendations, and we've done an extraordinary job here in Nevada County. So it won't be long. I would imagine a matter of weeks before we reach that sometime in April.
Mm-hmm. And there's several questions about vaccine preference or vaccine shopping. So people that want one vaccine over the other. The way I understand it, and what I saw from everybody from Dr. Kellermann to Dr. Fauci to everybody saying, if you can get a vaccine, it doesn't matter which one, Pfizer, Moderna, or Janssen, take the one that's available. Now, some people have a preference for the Janssen vaccine because it's only one dose, but when is vaccine preference, is that ever even going to be an option?
Well, I'd have to say that if you got your first shot as Moderna, you better follow up with that one. That's where you have to be very explicit. Or Pfizer, you follow up with a Pfizer. You can't be mixing and matching, or you certainly can't go from Moderna to a Johnson & Johnson. But no, we just parse out our immunizations with respect to its allocation from the state. And we see them all being viable and all being very effective and all having similar side effect profile, which is relatively minimal. So I see no value in vaccine shopping, and I don't even know where that information is available. If they sign up on my turn, it doesn't say which clinic offers which vaccine. There are certain people that I think would be more appropriate for Johnson & Johnson if they have to get immunized quickly. After your first shot, 2 weeks later, you're immunized. If you do Moderna, then you're looking at a 6-week time frame for being, fully immunized. But I think that would be where we'd look as the health department, where if somebody need to be immunized immediately, we may kind of route them that way. But I'm not so sure why, looking at the vaccines, why you'd even choose one over the other. They're all equally effective and all have equal side effect profiles.
I will say, though, that within the My Turn system, we do name our clinics. So if it's a Pfizer clinic, it says it's a Pfizer clinic. So it doesn't really allow someone to shop, but it enables someone to see what they're signing up for.
Mm-hmm.
And that's the case, I believe, on the CVS and Walgreens websites as well. When you go and sign up, it tells you what vaccine you're getting.
Yeah.
And we have our anonymous attendee that is asking what is the number of vaccines that are available sitting in storage, and what percentage of those are being withheld for second doses. So I think it might be worth saying that vaccines on hand, but what is happening with those?
Yeah, I can say that vaccines on hand are all planned for. I wouldn't say just because we have them on hand doesn't mean we're sitting on them. So there might be scheduled appointments. We're talking about planning an event, and we know some of our other partners are planning events, and we need to have vaccine on hand in order to do that. So all of the vaccine that is here is planned for. I don't have the breakout of first and second doses because our allocations just don't work that way, and each provider is in a slightly different place. So I don't think we can provide the information that's asked for, except I can assure folks that I would steer away from the idea that we're sitting on it. Everybody is putting it out as quickly as possible, but we still need to have some on hand to plan those appointments in a responsible and thoughtful way.
And maybe somebody can talk a little bit about the REACH team that has been visiting senior mobile home parks, for example, and others. So maybe talk a little bit about that as well.
Well, the REACH team is Resources for Equity and Access in Community Health. That's our REACH team. It is a mobile team. It is in place to ensure equity and access for those who may have challenges. So the REACH team is doing outreach to low-income pockets of population, senior pockets of population who may have access issues, whether that's internet connectivity or transportation issues. And yes, they've been really successful. I think it's actually, I know that others have talked about this, but it's been a joyful experience to go out and vaccinate folks. So they've been at independent living facilities, and we have at least one facility now where their residents are fully vaccinated. And that's a real life changer for them. And then, yes, another independent living facility, they were at a senior mobile home park this week, and they'll be at a similar place next week. So we have a public health nurse who's doing that outreach to those multi-unit housing facilities or those communities. And I think people are very happy when they hear from her, and it's really good work being done.
I really think that's probably the best of the health department. I mean, this is the essence of reaching out to people that are difficult to access. You know, they may have lack of computers, mobile home parks, mobility issues, and I think this is the best of what the health department does. I mean, Whispering Pines and things like that are a little more flashy. REACH is the behind the scenes effort to immunize people that would have no other access to immunizations.
And I just got a text that actually talking about notifications. So people getting the second dose, apparently the My Turn, it works. People are getting a confirmation like, hi, congratulations, you have now received both doses of the COVID-19 vaccines, and then details from the appointment, and then also enroll at vsafe.cdc.gov for check-ins, continue to stay safe and wear a mask, and questions, then there is a link for a chatbot. So that portion, at least of the notification for My Turn, seems to be working. And the question about Sarah County is vaccinating everybody 18 and over. So why has Nevada County not gotten the appropriate number of doses given our senior population?
Well, I'll answer that. I know Sierra County really well. Celia's public health officer par excellence, and Frank Lang in Downeyville, and they got 3,600 residents in the county. I mean, you don't have to have many immunizations to work right down those, right down from 65 and below. And that's what they've done. I mean, it's the essence. I mean, it's kind of the best of public health. You know, yeah, they got guidelines, but they exceeded those guidelines and they're keeping on doing. Your first question about hoarding vaccines, well, you know, it sounded like hoarding. Nobody does that. It doesn't happen. You know, yeah, we have to plan, which is a little problematic now because we get our allocations or they let us know a week ahead of time. And how do you plan a mass immunization clinic? It's very difficult. And if Sierra County, to their defense, if they said you have to wait, what do you do with those vaccines when people really want them? And so Sierra County has just made the decision in collaboration with the state to immunize everybody. And they're doing a great job.
Mm-hmm. And is Nevada County, do you plan on participating in the My Turn volunteer program for medical professionals and non-medical volunteers to help with vaccine site logistics? People can volunteer to work for shots even if they are not otherwise eligible, and there is myturnvolunteer.ca.gov would be the website. Is Nevada County, do you need hands, and where can people sign up?
So Nevada County won't be using that. We utilize volunteers who are enrolled in the Disaster Healthcare Volunteer site, and that can be found at healthcarevolunteers.ca.gov. But I will say that doesn't mean that other partners, vaccine partners, as they get enrolled in My Turn, they may be taking advantage of that. So I don't want to say that it won't be used in Nevada County, but we as an organization, Nevada County, we pull our volunteers from another database, and we've been working to direct people to that one. Having two is causes a little confusion. We're sorry about that, but yeah, we're sticking with the Disaster Healthcare Volunteer database.
And I would like to say it's worked very well. If you come to Whispering Pines, you will be greeted by a volunteer. You will be moved through the system by a volunteer. You will be exited from the system with a volunteer, and they're very well trained, and they're very diplomatic. They know about human resources and engagement of people. And I think you will find, well, you won't see smiles on anybody's faces because everybody's wearing a mask, but you'll see the twinkle in the eye. And some of the volunteers are well-known community movers in this community, and they say that it's the best thing they've done is to volunteer there, come and work a day at the clinic and move people through the system and see people that feel such a sense of relief from being immunized. So we've been utilizing those volunteers, and it's worked out exceedingly well.
And if I could add that yesterday, Susan Humanit's publisher got her second shot, and besides being incredibly excited about the second shot, we were a little concerned, of course, with the weather, but Public Works did a great job, and we were able to get there. And like you said, the volunteers, the whole from walking in there to going and getting the shot. And I think maybe you should say that you are escorted through the whole system, but the shot, those are nurses that give the shot. It's not the volunteers that give the shot. But then you have, and then you make people sit in rather comfortable chairs, apparently, for 15 minutes just to make sure that there's no immediate adverse reaction. And people came out, and I know when Susan was in the car, she took her mask off, and there was a huge, huge smile on her face. So that's definitely.
I imagine she received a smile from you too, right?
Yeah, well, that goes without saying. With that, we have, if anybody has in our attendance has any pressing questions, otherwise I have a few other questions that came in via text and email. The several of these, I think we kind of answered those already. It is the why can't we sign up for a waiting list for vaccine that for one brand or the other? And I believe, Ryan, I think you answered that in the chat already. Or did you?
Yeah, I simply answered that it's not something that we have available, a waiting list for a particular vaccine. I think we already described that the best vaccine to get is the one that you have available to you. I think, I don't know if we talked about this, but typically when a clinic is being run, you don't want to be mixing vaccines. It's typically one type of vaccine. And so people aren't just going to have a menu, and there's a number of reasons for not mixing the vaccines at a given day of operations at the clinic. But as Jill also mentioned, a lot of the providers advise you of what vaccine you're getting, and so in theory you could refrain. But again, we're definitely advising people to get what they can get because they're all highly effective.
And we're approaching March 15th, which is when when more people apparently will be eligible. So who wants to look into their crystal ball and say how that will play out in Nevada County? Okay.
Well, I mean, high level, how that's going to play out is that, a much larger slice of our community is going to be immediately eligible. And the reality is still going to continue to be that there's not enough vaccine available for all of those folks. We certainly are eager to get the community vaccinated as quickly as possible, and people with underlying health conditions that make them vulnerable, are a high priority to get vaccinated. And so they will become eligible through my turn, just like anybody else who's eligible come Monday. And hopefully the state will provide clarification that makes it clear what exactly that means to qualify on Monday. But so that's my crystal ball.
Because one of the questions was if you release appointments on Friday, can somebody who would be eligible on Monday, can they sign up on Friday?
No, I don't think my turn won't recognize you as somebody who is eligible for those appointments. But I will just throw in as well that we have a number of primary care providers in Nevada County who are receiving vaccine. And I know that the state is recommending that if you can get vaccinated by your physician, that's ideal. And I think they're going to put something out before the 15th, so today or tomorrow, with some recommendations about how this may play out. And maybe just one other caveat, and some of the people who will qualify as of Monday, it will take a little more effort, which is not a bad thing. It's just a thing that we'll have to spend a little more time for homebound individuals. What does that look like? And so it won't be, there are many components of delivering vaccine to that population that won't be speedy, even with enough vaccine. So we'll ask again for people to be as patient as they can be, but there should be a number of mechanisms in place for them to get vaccinated.
And that, I think, goes back to that question of vaccine sitting on shelf as well. All our vaccine is planned for, but part of why sometimes it doesn't get injected the day it comes in is because we have to plan to get it to a vulnerable group that's not going to be out there refreshing My Turn or the CVS website. And so it's not sitting on the shelf, it's being planned for that kind of outreach.
And it's planned to be used within that week. It's not gonna, you don't plan a month in advance. At this point, you can't, can you see this far into the timeline?
I would say that it's probably going to be within 2 weeks. I think that's a fair assessment, because if you're notified this week and you're going to get it the following week, for some, again, these are practices that are regularly seeing patients, and they need the time to plan and schedule those additional vaccine appointments. And then again, if you're planning a larger event, if you're planning a mass vaccination clinic, that might take a little more time to plan as well. But it's within that time frame.
I think the original question around that was second doses, like how many are we saving for second doses? And I definitely want to correct any impression that if we get 5,000, we save 2,500 of them for second doses, as there's a cadence. And when we find out how much vaccine we're receiving, we pretty much know from our providers and from ourselves how many second dose appointments are needed next week. So we're planning that out of the vaccine we're getting in real time. We're not holding it over the 3 or 4 weeks that people need between their doses.
Yeah, it's not that you get one dose and somebody's gonna carry the second dose into some really cold storage for now and place it there until you get the second dose. So that's
Right.
I think that's important to clarify. And we will wait for the state's update on the March 15th. If I can be so snarky as to say, I will expect it on Friday afternoon or early evening, and that, by the way, in media speak is called a Friday dump. That is normally when you want to take out the trash and nobody pays attention. It's a Friday dump. So we will keep you up to date. Meanwhile, any last words of wisdom? Because we know already the answer to all the mysteries of the universe. We know that one. But any last words of wisdom, Dr. Kellermann?
Well, I just like to reiterate that Board of Supervisors meeting, although it's contentious, I really appreciate working with the Board of Supervisors and the fact that they're willing to, to put their heads together and appreciate the value of public health, what it brings to the equation. And then for people, the word of wisdom, Pascal, is for those that, follow Marvel comic books, obviously, with great freedoms come great responsibility. Spider-Man. So I will leave a Spider-Man quote. So be responsible. Thanks.
Thanks. Brian, Jill?
I don't know if it's words of wisdom, but I would say we really appreciate these opportunities. We hear all the time that people still want more information, and we actually want to hear that. We want to know what people want to know. We want to know how they're getting their information. So please do continue to reach out. Let us know where you think there are information gaps. Pascal, we're so grateful that you hold these sessions so that we can answer questions in real time. Yeah, so just keep reaching out to us, keep reaching out. I want to give a shout out to the PIO team. We are a small department, but the county has a great public information officer team, and they definitely support those efforts. And I know they want to hear from the community as well. So don't ever hesitate to reach out. Thanks.
And my only comment would be, to echo Jill, we appreciate everybody's eagerness to get vaccinated, and we are just as eager as you to get you vaccinated. So, so we will get there, and it's not going to be too much longer.
So in other
Thanks.
words, continue to wear a mask, wash your hands. That's where the towel comes in really handy as well. And keep your distance. And Dr. Kellermann,
Be wise, immunize. Thanks.
there you go. With that, thank you, everybody. Thank you,
Thank
Ryan,
you.
Jill, Scott.
Thank
Thanks to all of our attendees here. And no, we have not answered about specifically when and if the Johnson & Johnson is going to come, because they don't know. And so, and the discrepancy between Nevada County and Sierra County is roughly 96,000 people. That is the discrepancy between Nevada County and Sierra County. With that, thank you, everybody, and we'll see you next Thursday. Bye.
Thank you. Bye.
Bye.